The challenges that we've got, we have about 350 employees, fully a third live down Valley. And for many reasons, some of which it's preferential, some of which most of it has to do with housing. A lot of people are coming up, and in fact, about 90 of those people are in Loveland, and so they're impacted by the Highway 34 closure as well. And that's very problematic for us. I'll just read some numbers to you. We see about 6,000 visits in our emergency department every year. Our clinic sees about 25,000 people a year as well. There's so much going on at the hospital, as I'm sure you all know, between all the rehab, the outpatient visits, what's going on with the inpatient. We have a lot happening with a lot of physicians and providers having to travel up from down Valley. And so we are discovering, or I'm discovering, the impact of the housing issue. I bought a house here, and it took a little while to find something a little more than I was planning to pay. But it was important to me, and fortunately I was able to be able to do that. I don't know what more I can say. I know what I wanted to say. We spend well over $500,000 a year in contract labor alone, just covering the positions that we can't employ. And that's principally in nurses and in CNAs. And the nurses are, as you might imagine, in the hospital, they are everything to us. Well, everybody is everything, but the nurses are important. And the CNAs, and much of that has to do with the Prospect Park Living Center, but also our inpatient units. And if we don't have the caregivers on site, then we can't take care of the patients. And the visits and the volume that we see are pretty good for a rural community hospital, such as Estes Park. And so the fact that we're able to survive is sort of miraculous at the moment. And finding affordable housing is just going to be the key to the hospital's survival. And that's really one of our top priorities, is how are we going to handle that?